afternoon, good afternoon. Dang on it, good afternoon.
Yes, sir.
Thank God it is Friday. Friday. That's what we live for.
It is. Amen.
Listen. Facebook, Twitter, YouTube, CareSouth family, South Carolina family, wherever.
Mm-hmm.
We back.
We back.
We took some time off. A little bit of breathing room, a little bit of renew, if they will.
That's it.
Yeah, but we back.
Oh yeah,
we back.
Right. And guess what? Guess what, too, Rick? It's Friday, and it's payday.
Ooh.
But before anybody send a message and ask me could they borrow $20 to the mall, it's already spoken for. So, but thank God for
it. Is it spoken for?
It's already spoken for. Bill and them got it.
Who is Bill?
Light bill, water bill, electric bill, whatever bill.
Gas bill.
All them bills, man. Them bills be in line on Fridays.
It does. That's funny.
Well, that's what's up. Well, that's what I'm talking about. But what brought us back, and we're glad to be back, and we're glad to be back because of this show here. Mm-hmm. We definitely wanted to come back, and when we came back to provide you with some awesome information. I think we found that, right? I think we found that.
I think we did.
Yeah, it's perfect time, right?
That's right.
Yeah. So the month of May is Mental Health Awareness Month. And I will say, and I hope I can speak for everybody here, that over the last 2.5 years during this pandemic, mental health has been at the forefront and should have been at the front for prior to this, but has really been at the forefront of folks dealing with this pandemic. I'm sure it exacerbated some mental issues, brought on some mental issues, and so this month we want to take the opportunity to kind of shed the light and bring awareness to mental health and also kind of dispel some of the stigma around mental health, and we have the right people today to be able to talk about that today.
That's right.
So I'm gonna, after I introduce myself, because I don't think I know we back, but we got some new viewers that don't know who we are.
That's right. That's true.
Right?
That's true.
So I want to start out by saying I'm Mark Calhoun. I'm the Director of Social and Community Services for CareSouth Carolina. With my partner in crime, we always.
Hey, thank you, Mark, for that opening. I'm Daniel Myers. I'm the Director of MATHD Services for CareSouth Carolina. And once again, I'm always glad to be on the podcast with my partner in crime, where we're bringing you great, good information, evidence-based information, and not just gossip while we're on the air.
Exactly. Probably on the air. I got some. So listen, for those of you that don't know what CareSouth is, CareSouth Carolina, we are a federally qualified health center in the PD region. We cover 5 counties: Marlboro, Darlington, Dillon, Lee, and Chesterfield counties. We have a variety of services from your medical services with a family care practice. We have pediatric services. We have, of course, our behavioral health services, which we're going to talk about a little bit more today. We have chiro. We have dental. We have women's services. Mm-hmm. We have the outreach team. We have community health workers to assist with social barriers. Mm-hmm. We have lab. We have an infusion department. We have Care Innovations, our infectious disease department. So we're one-stop shop of healthcare. We're the Buckies of healthcare. We are the Buckies of healthcare, right?
That's right. We got it all.
We got it all. Pharmacy on the way.
Absolutely.
Yeah, we got pharmacy. I didn't mention pharmacy. We got services available for those with state insurance that work for state agencies. So we cover a gamut of services. But what we're going to talk about today are our behavioral health services. And so I'm going to step out the way a little bit, and I'm going to let these ladies introduce themselves.
Yes.
Okay. Thank y'all so much for that. It's good to see y'all again. I've been on here a couple of times. I always enjoy doing the podcast. I'm Amy Cook. I'm the Director of Behavioral Health, and my partner in crime down below can introduce herself.
All right. I'm Robin Gibson. I am the Behavioral Health Supervisor, and this is my first time participating. So thank you guys so much for having me and for having us to come on and talk about mental health. So we really appreciate it.
Oh, yeah.
And Marek, I'm going to have to tell you, since the podcast, y'all took a break, I kind of took Daniel from you a little bit. He's kind of my partner in crime now. So just saying.
Right. Boss lady over there. That's boss lady over there.
Hey, that's okay. We share. That's enough for them to go around. We split
That's
right
right.
in half.
That's right.
That's funny.
That's right.
So
yeah, I ended up with that trifling cowboy hat though.
Okay.
We them boys. I don't care. We them boys.
Okay. You can have that.
Hold yours.
You can have that. So the month of May has been recognized as Mental Health Awareness Month since the 1940s. And every time in the month of May, CareSouth really tries to get involved. It has been an amazing week. This week we have had Spirit Week, so we have dressed up as superheroes for mental health. We've been doing Beach Day for mental health. We also, today's Hat Day, so Daniel's got this.
Daniel.
I didn't want to mess up my hair, but Daniel's got this. So, but we've really enjoyed this week, and everyone participated. So please go to the Facebook page and look at all the pictures. It's been a lot of fun, and it's really a good way to bring awareness to mental health. CareSouth recognizes the importance of everyone coming together to raise awareness for mental health. We want to raise awareness for our patients. We want to raise awareness for communities, for even other organizations, because we have a lot of outside referral services that we have contact with, and so we really want to reach out to everybody to provide the education on health issues, provide education on and support increasing access to mental health services, and really being able to advocate for better health care and for better mental health care. So that's what we've kind of done for the month of May, is really we wanted to kind of take over the podcast and talk about what services we offer and why we have been so involved and why we continue to reach out to our patients and our community to bring awareness. So that's why we're here today.
Absolutely. And we're glad, like I said, we're glad to have you here. So let's kick this off. Tell me, if I'm a new patient of CareSouth Carolina, or I'm someone, not even new patient of CareSouth Carolina, I'm someone or one of the clinicians at another organization, or I'm just an individual coming in and I'm doing my research and I want to get some counseling. What's my first step in doing so with CareSouth Carolina?
Okay, I think I can.
Go ahead. You can take this one.
Yeah. So one of the questions that I know that I get asked a lot, and I'm sure you guys do too, is does CareSouth accept outside referrals? And so that is definitely something I want to mention, is that we accept both inside and outside referrals. So, we don't just accept those referrals from our own providers within CareSouth, but also with other agencies, with other doctors' offices. If a friend of a friend refers you, a self-referral, anybody can call CareSouth 843-332-3422 and speak with one of our wonderful ladies or gentlemen at the call center. And simply request an appointment with a counselor. And they will make that happen. They will get in touch with who, they'll either make the appointment or get you in touch with one of us so that we can make that appointment for you. So you do not have to be a patient at CareSouth. You can, again, a friend of a friend, and you can just come on in for an appointment, and we'll be glad to see you. Yeah. If you are a patient within CareSouth, stop by the front office, ask your medical provider, call the call center, and you can easily make an appointment that way.
Yeah. And also what's been quite new actually is making contact with us through our online portal. So I do receive multiple messages where patients can just actually put in their information and they're sent directly to me, and then I can reach out to the counselors for the location that they're requesting appointments for as well. So online portal is a really good access to make appointments as well.
Well, so I got a question too. I mean, that's wonderful. I mean, that access and availability to care and counseling, that's wonderful. But what if I come see you? I mean, who else gonna know my business?
Everything is completely confidential. With behavioral health, it's the great thing about CareSouth and what makes us so unique is our ability that we provide integrated behavioral health care. It is a warm handoff from the provider to the counselors. Everything is completely confidential. We only, consult with our medical providers, but we work very closely with them to make sure that all the patients are getting the services that they need. A patient may come in to see their medical provider, and it may be their medical provider that recognizes that, okay, something's kind of off. They're more down, they're more depressed. Their mood is different. And so the medical provider may say, hey, we have a counselor here in the office. Let me walk you over to meet her or him. And, we can go ahead and get services set up now. So, but everything within CareSouth is completely confidential. Sorry.
No, that's okay. So that's good. I'm glad to know that, because I don't want everybody in my business. But how are people going to know? Are they going to know that when I come to the office that I'm coming to see you, or do everybody look alike in that waiting room, or is there a special area for me to sit, or are we separate? Are we separate? Like, if I'm going to see Chiro, do we have a Chiro waiting area, a medical waiting area, or behavioral health? How does that work in CareSouth? I mean, I heard they had a wonderful system, but y'all might need to expound on that just a little bit. Let everybody know about it.
Just a little bit.
Robin, he sounds like he needs to expand, doesn't he?
Right. So, speaking for that, I'm located in the Hartsville office. And so on my side of the building in Suite A, we have Chiro, we have medical providers, we have counselors. And so we don't have separate waiting areas. We have everybody together. And so there's no way of knowing if somebody is there for a behavioral health appointment, or whether it's a medical appointment, or an appointment with the chiropractor, or even to come in and see one of our community health care workers, who are awesome, by the way, and help us out a lot. So you're not walking directly into a counseling office, waving your flag, I'm here to see my counselor today. You're coming in and you're sitting in community with all of our medical patients as well.
Yeah. And that even goes for people who are just simply coming in for labs. No one is separated in the office. We treat the whole person. So whatever they're coming in for, they come in for. And actually, speaking of confidentiality, so if a patient goes in and sees their medical provider, say it's a person that needs a note for work or they need a note for school, for instance, even if it was coming to see the behavioral health counselor, it still does not say on the note that is needed for work or school that it's for counseling services. So it is very, very confidential when it comes to seeing one of our behavioral health counselors.
Well, that's wonderful because that helps with the stigma part of it, because there's a stigma behind going to see somebody because you're crazy, right? Or you're going to see somebody because, you just, I don't know. I don't want to see this is not y'all, but this is people talking. I don't want to see no quack about my mind. I got all my sense. I don't need that. But there are other things that you assist with, like marital counseling. You talk to children. You do a whole bunch of things. Can y'all just tell us some things that y'all help us out with as being patients, family, or whatever? Just tell us a little bit that y'all help us out with.
Yeah. So, it's good that you brought up something like marital counseling. The reality is everybody goes through changes, no matter who you are, no matter your race, your gender, sexual orientation, religion, everybody experiences change. And so whether you're dealing with something more severe or whether you're just dealing with an adjustment, just a life adjustment, and you need to come in and talk to somebody, those are services that we provide. So whether it's marital counseling, counseling for anxiety, depression, trying to just deal with the changes from the pandemic, PTSD, bipolar personality disorders. So we kind of run the gamut of what we're able to treat, from things that are less severe to those things that are more severe.
Yeah. And to add to that as well, mental health concerns and mental health issues, they don't discriminate. It doesn't matter what your age is. It doesn't matter what the diagnosis is, gender, race, ethnicity, anything, social status, none of that matters. And we do all go through things, and we do sometimes need to reach out and get help. And at CareSouth, now we see all ages, for the most part, at least from 4 or 5 all the way up. And every counselor is trained in our profession to see all ages and to see all diagnoses. So when you call and make that appointment, we just need to know what location you're at, because our counselors are able to treat this whole, the whole person. We're able to treat from anxiety to depression to bipolar disorder to trauma to, marital counseling, addictions. We're all trained to do that. And so that is another, unique thing about CareSouth, is that we have so many. And actually, I did want to cover that because we are growing. When I started at CareSouth in the behavioral health department, there was 8 counselors. We are currently up to 18.
Wow.
We have 18 counselors.
Wow.
And they're all master level professionals, and we have them in every single, mostly every single medical site within our service area. We also have Dr. West, who is amazing, who is our clinical psychologist that provides testing, which is something that is really needed. Testing for ADHD, testing for autism, testing for cognitive disorders, or say you have a geriatric patient that's struggling with dementia or Alzheimer's. Dr. West is really great with that. And we've contracted with the University of South Carolina, where we have 2 psychiatrists who actually provide consultation to our patients through telepsych. So our services have really, really expanded, even into the schools. I know it's like a lot, it's like a mouthful, but I mean, we just really have grown so much. We're school-based. We have school-based counselors who are strictly school-based counselors. And most of our school-based counselors are all within the Chesterfield County area, and we've just expanded to Marlboro County. And we have 14 schools right now, which is a huge deal. We've increased to 14 schools. So now we're not just getting them in the office, but we're meeting these kids where they are, and they're being able to be seen where they're comfortable at their school. And it helps filter, having room for other patients when the kids are being seen at the school. And this, we're all the same team, and it just, and still be able to get services at the school and in the office.
Well, so with me, just saying me personally, if I'm afraid to come into the office because COVID is picking up now, is there any way for me to have an appointment with you guys without actually coming into the office, or even if I don't have like a computer screen, is there anything else I can do to have my appointment with you guys?
Yes.
Yeah.
Robin, you can take that.
Yeah, absolutely. We're currently providing not only, in-house services, but we are also providing telehealth services through, .CME, and then we're also providing telecommunication. So if you don't have a phone, or if you're in an area where you don't have a lot of, or don't, to be able to access video, we'll do a telecommunication call, and we can talk on the phone. So, we're all about reducing those barriers to treatment, and, being able to talk on the phone, through video, or face-to-face. You've got several options of being able to receive services at CareSouth.
Absolutely.
Wow. That's wonderful. I didn't even know you expanded to Marlboro County. That's great.
Yes, we have expanded to Marlboro County. Yeah, and we're fixing to expand the behavioral health department too. So we're really doing a lot of things. And I wanted to add too, which is Daniel's baby, but we also within behavioral health provide medication assisted treatment, MAT services for substance use disorder, opiate use disorder. We really are CareSouth. We really fighting this problem that we have all over the nation with opioids, and we're trying to fight that. And we're doing such a great job, and Daniel can speak more on that, but that's also a part of the behavioral health program in that we get to see some of these patients and work with addictions, and we provide that service at CareSouth as well. We work very, very closely with the providers and the local DAODAS agencies to provide that service.
That's right, and that's a wonderful thing, because MAT, I love MAT. I love the program, but MAT offers an opportunity for patients to reach a level of sobriety with the use of medications that they wouldn't normally have that resource. And CareSouth right now we have 21 MAT providers, which is one of the largest programs in the state of South Carolina. Mm-hmm. And we one of the most successful with the patients that we see, with the amount of patients that we see. But we cannot do that, like you said, without our partners, the oldest partners, which is the Alpha Center, Rubicon Behavioral, and also Trinity Behavioral Care over in Dillon and Marion County. But without behavioral health, the program will only be half successful. And so it's a must that the patients that we're seeing for MAT have that level of counseling to help with behavior modification, to not just get them on medication, but change their mindset about addiction and let them realize that there's a better way than what you're doing. Give them some other avenues, some other resources, and some other ways to approach the problems that they have with addiction. We have wonderful counselors here. We have wonderful counselors with Trinity, but our program would not be as successful as it is without the component of behavioral health. You cannot have any health without good mental health. And so we have to start there first. It's very important. Very important.
That's right. So I want to take it back for a second. Amy, you brought up the integrated model of healthcare that we have here at CareSouth Carolina. when you come in as a patient, a regular patient of CareSouth Carolina, there's a during the workup process a form called a PHQ.
Mm-hmm.
Could you kind of explain to us what that form is? Because every one of our patients during their initial visit gets a PHQ done, and kind of tell us about that PHQ. How often is it done, and why is it important for and why do we at CareSouth Carolina administer that on every patient that comes through our door?
Okay, so the PHQ is our patient health questionnaire. And within this questionnaire, it basically it asks questions related to mood, to feeling down, to feeling sad. It discusses symptoms of energy, whether your energy level has been, abnormal, or how someone is sleeping at night. Is their concentration and focus off? Are they getting out and doing the things that they were doing before, or has that changed? Are they isolating at home more? And it also addresses suicidal ideation and self-harm. This form is completed on every patient at CareSouth Carolina annually, and every patient that we see in our office that has a diagnosis of depression or related diagnosis at every visit. And we do this because things can change from week to week. And, it's important for us to ask these questions to see if there's any changes that are going on at home, whether it's us that recognizes it, or because in a lot of cases, when the patient comes in to see their primary care provider, it's the nurses who are actually doing this form with them. And then what we do is, we kind of say, if you see anything on this form that is indicating that they may have some issues with depression, or may have issues with anxiety, or that something's going on that's just out of the norm, walk over and get us. Let us meet them. Let us set them up for an appointment with behavioral health services, so that we can kind of do an assessment and see what's going on. But, the purpose of that is for us to be able to, track, that who has depression, and are they following up? Are they getting the services that they need? Is there someone that we need to reach out to and bring into treatment? And that's when, your team's really good at getting access to some of those patients as well. But, this is done, and it's a very, very helpful tool to identifying depression and related depression disorders related to depression.
Well, I got a question too, since we're talking about the forms. There's some other forms that you use to help gauge what patients need when it comes to substance abuse. Am I right?
Yes.
Is there a DASH-10 or CAGE form or something like that?
Yes.
I don't know for sure, but is that what it's called?
Yeah, it is. Yes. And the nurses complete that too. And while, as far as behavioral health goes, when a patient comes into us, that we do that every visit. We do what we have as an assessment. The nurses do, the CAGE and, those type forms as far as getting the information. And that's kind of how we'll receive services even for our MAT department as well. But we also at every visit discuss substances with the patient. If there's any substance been used, how long, and then a lot of times that ends up being a referral for continued services, because behavioral health, we do short-term counseling services. Someone may come into us for grief, for instance, or something like PTSD, and so for something like that, you may need long-term services. And we kind of determine that because we do those assessments at each visit. And substance use disorder and opioids use disorder, we do that at each visit.
So what is medication for some of these diagnoses or some of these things coming? What does that come into play? How does that factor in with you, the counseling and the doctor's visit? How does that factor in? Do all of our patients have to have medication, or is it just certain diagnoses that have to have medication, or is it an individual need basis?
So I would say, it's based on the individual need. As counselors, we cannot prescribe medication. But what we can do is work very closely with our in-house medical providers and other medical providers within the community if that individual is maybe not making the progress that we would hope that they would make. So we were talking about the PHQ form earlier. That is a form that also tracks progress when it comes to your symptoms with depression. So say you've been going into counseling, you've learned a lot, you're doing a lot, but you're still not feeling your best. We may recommend that you talk to your medical provider to see if medication. So, we have counseling only clients, and we have, clients who are only on medication, and then we have clients who receive all of the above.
Yeah.
Okay.
So it's the individual plan of care.
Yeah.
Well, I got one more question. Then I promise I'm not probably gonna ask anything else for the next 3 seconds. But this one is so if I'm in a doctor's office and I've just received a diagnosis from the doctor, maybe with a chronic illness or infectious disease or something like that, is there an opportunity for you guys to come in at that time and help with that transition or help with the, how to help me with that issue, with that burden of now I got this disease, I got diabetes, I got hypertension, I got, whatever. Do you guys, do you help with that? Do you help assist with that part of it?
Absolutely. If because that's what, when she was talking earlier about adjustment, just a life adjustment, an adjustment to a new diagnosis. So we do see patients for, getting a newly diagnosed diabetes or high blood pressure. But that's also really when we work really closely with Marek's team, and Randy Carlisle's team and Dr. Duncan's team that really works at teaching the patients the education on diabetes and making sure that they know how to manage this diagnosis. And then we kind of come in. So that's why it's like it's a whole person approach, because they have their medical provider who helps them. They have all these other services who are helping them to learn how to manage the diagnosis, and then us who are helping them adjust mentally to this new lifestyle, which can be really hard to adjust to. And so we work with them on different skills, different coping skills, just to help them kind of adjust over to what, their new lifestyle that they've got to manage.
Well, okay, my 3 seconds is up, so I can ask another question. So listen, me being a CareSouth employee, and probably don't want to talk to y'all about my business because I see y'all every day. Is there other services that's available to the employees and their families or members of the household that CareSouth can help? If I don't want to talk to you, wonderful ladies, y'all are very wonderful ladies, but I just might not want to talk to y'all. So,
well, we are so glad you asked that question.
Yeah, we can teach this.
So recently, because that's very real, Daniel, we all work together. And so you don't want to maybe come and see the counselor that, you see walking through your office every day, or that you're consulting on cases with, or that you're assisting, or they're assisting you in different things. So we recently, Amy probably can speak a little more to this because she is the one who actually worked so hard on getting all of this set up, but we do now have an employee assisted program with McLeod. And so any of our employees and their family members who live inside their home, their immediate family members, would have access to EAP services through McLeod.
Yes.
Yes.
And so basically what that looks like is we've contracted with McLeod. Mm-hmm. McLeod provides, we are actually the EAP service for McLeod. So if there's employees at McLeod that, want to also get counseling services, but just doesn't quite feel comfortable getting services, where they work, we've always provided that service for McLeod. So it just made sense. This was we already have this great relationship. And so what we've done is contracted with them for our employee assistance program, and employees can self-refer themselves. All they have to do is pick up the phone, make that phone call, and they get services. CareSouth, pays for that service for our employees and their immediate family members. And also they see, for the same thing we do, from anxiety to depression, they provide telehealth, they provide telecommunication services, face-to-face. They set you up with organizations that are closer to your location because they have so many affiliates that work with them. And so we're really, really excited. This just rolled out in March. I've been around to some of the locations in the past couple of weeks, educating all the employees on this. And this is really, really exciting for them to have this service.
Oh, good.
And let me say this too, because I feel like it's important to know, CareSouth has been wonderful about making sure that the individuals in our community have mental health services. But just how amazing is it that they want their employees to have that same benefit? Right. I think that, I know that, Miss Ann Lewis, CareSouth, powers that be, just really care about our employees and want us to be able to have all the same services that we provide to our own patients. So right. I think it's pretty awesome.
Right.
We're really excited about that service.
Yeah.
Absolutely. I am too. Absolutely. That is special. It really is. It's special. Mm-hmm. What you guys are doing for not only the employees of CareSouth, but in the community as well. You mentioned earlier that you're expanding. So that means you're going to have some positions open.
We do. I do have currently a position open for our Bennettsville office. So please apply.
What's the qualification for that?
Yeah, what's the qualification?
So the requirement is that you do have a master's degree in social work or counseling. And so that's your LPC or LMSW, LISW, licensed independent social worker. But the requirement is master's level counselors and for the position. We'd like to see someone with some experience in substance use disorder and things like that, but it just depends. A lot of people have different backgrounds, and one person may have a bachelor's degree in psychology and a master's in social work, or the complete opposite. But it is required to be licensed as a master's level.
Can I be a LPC? Well, I know they call it intern back in the day, but I think it's different now. As associate, something like that. Okay.
You just call me.
I've been keeping up, right?
Yeah.
So they came to you for some supervision.
So yes, actually, Robin just updated to be able to do supervision for LPCs. That is an additional training and additional thing that you have to do once you're even master's level. But we do. We provide. We have multiple contracts with different universities and schools where we provide internship for social work. We provide internship for licensed professional counselors. And we actually have 4 students right now.
I think that's right.
And we love it. We love having students. We love being able to give back. For me, somebody had to take me and I had to intern and, show me, how this, what this looks like and how to provide counseling and what it really looks like when you're at the facility that you're working at and actually being able to see patients. And so we really love to give back to students to provide that service for them.
There was somebody on this broadcast that Robin used to supervise, isn't it? Once upon a time? Who was that?
Once upon a time. That was a long time ago. Yeah, so Mark and I actually met how many years ago?
Oh, man, it's been about 10, 15 years ago.
Before my CareSouth years. And so we had some fun together while he was doing his internship with me some years ago.
That's so funny. I think I'm pretty no, he was my supervisor like 10 years ago. And I was doing lab. That is a great thing about CareSouth. I will say that, we really, CareSouth is good to their employees. We want us all to be successful and move up, and with the ability to do that. And I'm just one of those that did that. So he was my supervisor when I was at Lakeview in the lab, Daniel, as well.
Yeah. I think I'm a poster boy for moving up at CareSouth.
Yeah.
Absolutely.
Or them thinking I'm leaving, but I was just kidding and didn't do that.
Well, I got a question for you ladies real quick before we go.
Okay.
We understand that if we're watching the news, that there's a lot of people right now experiencing anxiety because of what's going on with the Roe versus Roe versus Wade, whatever that thing is, and also with the mass shooting that happened in Buffalo. I've had several people to call me this week and express their concern and their anxiety, even about going to Walmart, going to the grocery stores, going to just being out in public right now because they're afraid. Because our communities are in so much turmoil right now. So if you had to give a word of advice to them right now, what would that be in order to to help ease some of the anxiety? And it's going to always be there until we have some changes in policy, of course. But before that change comes, we need help. So what is the best advice, and what can you tell them, and what can you offer them during this time?
Go ahead. That's good. Go ahead, Rob.
Well, I was just going to say, what can we offer is, we can offer an ear. That's what we're here for. This is one of those adjustments that we're talking about. We're going through some difficult times and some challenges. So, if you're experiencing some anxiety, call us. Talk to us. Let us help you work through that. You can call us. You can talk with us on video, or you can come in and see us in the office. So, there's nothing wrong with that. There's absolutely nothing wrong with picking up that phone and calling and saying, I'm having a difficult time. Can I just need to talk for a little bit. It might be 2 sessions. It might be 6, whatever. But, there's absolutely no shame in that. Pick up the phone, call us. That's what we're here for. That's what we want you to do. So, that's what I would say is reach out. Yep. We're here.
Yep. Absolutely. Thank you, ladies. We thoroughly enjoyed you sharing today, sharing this great information about the services you provide at CareSouth Carolina. It was wonderful having you on and as guests, and we surely will love to have you back. Matter of fact, you will be back here, hopefully in the next few months to kind of give us an update on the department and what you're doing, right?
Yeah, sounds great.
All right, and we do have, like I said, this is the month of May, which is Mental Health Awareness Month, and y'all have taken over this podcast. What do y'all have in store next for this next upcoming show?
Okay, so go ahead. Go ahead, Robin.
I think the next one's the 27th, correct?
Yes.
So we have 2 fabulous counselors who are going to be jumping on and joining you guys, Miss Dee Dee Boyer and Asia Penzo Shamard, and they are going to be talking to you guys about mindfulness. So there's going to be a lot of awesome information coming from these ladies. Everybody needs to jump on. You will really enjoy it, get a lot of good tips and some good information. So definitely jump on the 27th.
Yeah. Speaking of anxiety, it would be great to watch that podcast. Mindfulness is a relaxation technique. It's great. And they are very good counselors. So.
Looking forward to that one.
Absolutely looking forward to that one.
All right.
Well, thank you again, ladies. And listen, if anyone needs information about CareSouth Carolina and behavioral health services or other service, you can reach out to 866-498-0399, or you can call any one of our local CareSouth Carolina phone numbers. It will connect you with the call center, or you can check us out on our Facebook page at CareSouth Carolina, as well as our website, www.caresouth-carolina. How many times I just said that one?
Yeah.
But yeah, again, thank you, ladies, again for this valuable information on Friday afternoon. And we will take heed and take all the information that you have, take it in, soak it in, and we will apply it to our friends, family, co-workers, and get the word out on behavioral health, the services here, and dispel and crush that stigma around mental health. It's okay not to be okay.
Yeah. Yeah. Thank you so much for having us.
Oh yeah. And ladies, stick around after the closing, please.
Okay.
All right. Thank you guys.
Thank you. Have a good
Absolutely.
weekend.
Yes, sir. And this is Mark Calhoun and Daniel Myers, and this is the CareSouth Carolina Community Live Podcast.